I'm Riley Reese. This is a Sophia Unfiltered podcast, where we bring together thought leaders, wellness entrepreneurs, makers, and emerging health leaders. We're here to have raw, unfiltered conversations because sharing your stories has the power to change lives, help others heal, and transform the way we take care of ourselves. Here we go. Hi, everyone. Welcome back to another episode of Sophia Unfiltered. Today, we are sitting down with Dr. Kimbi Marenakos. She's a national board-certified family nurse practitioner and behavioral health specialist with over 20 years of work in healthcare, education, and nonprofits. Welcome, Kimbi. How are you today?
I'm fantastic. Thanks for having me.
Yeah. Why don't you tell us a little bit about your story, yourself, and what got you into health and wellness?
Well, I am one of four children. My father was a psychologist. My mother was a nurse midwife. I'm the one of four who said I didn't want to be anything like my parents. So there you are. I'm both in psychology and in nursing. So I was practicing as a psychotherapist at a master's level for about 12 to 15 years, 13, 14, somewhere in there, when I realized that I'm working alongside family medicine providers, and they neatly like to compartmentalize. They like to take care of the body and allow me to take care of the mind. And it didn't resonate for me. So I wanted to take care of whole people. So I decided to go back to school. I did my doctorate, and knowing that I had my master's and at that point, 13, 14 years of psychotherapy experience, I decided to go back to school and do my doctorate on the family medicine track so that I could make behavioral health and mental health services available in a primary setting for patients, knowing that so few actually have access to specialty services for many reasons, one being cost prohibition and just different ways that we make it difficult. We create obstacles for people to get the care they need for mental health. So
wow, we could talk about that for a long time. Yeah, we're big fans of your work. Obviously, with Sophia Health, we believe in this holistic. Is just this mindset is needed. The shift in mindset of how we take care of ourselves is absolutely needed.
Definitely. And I think the bigger shift, it might be unpopular for me to say it, but I think the bigger shift is needed on the side of healthcare. I think we all have to start recognizing that it's insufficient to take care of part of a human being and not recognize the interdependence of body, mind, and spirit.
We literally could not agree more with you. And it's so funny. I mean, like, you nailed it right on the head, where it was like, when we're looking at whole person care versus compartmentalizing, oh, this is the ailment of my wrist versus the ailment of my emotional well-being as two separate issues. It's like, okay, well, the definition of insanity is repeating the exact same thing over and over again, expecting a different result. And so, to your point, yes, we're both big believers in treating whole person health, all of the things, spirit, mind, body. So yes, bring on the wisdom.
Well, and as you know, the mind, that is like the wild, wild west. It's the last frontier, yet to be fully understood and explored. And we fear what we don't understand. So I find so many healthcare providers love to punt. They love to delegate anything to do with mental health, behavioral health, addiction, anything remotely psych-oriented gets referred out because it's complex. It's not something we can measure and quantify and throw medication at it precisely on the first try. So I find that it's unfortunate. The ones we sacrifice are the patients. So
yeah, we can dig into that for a long time. Today, specifically, though, an interesting topic is burnout. You say the devastatingly beautiful gift of completely burning out. Can you touch on that a little bit for us?
Oh, I can touch on that a whole lot if you want. My background, as I mentioned, I had been doing psychotherapy and working alongside primary care providers. And again, I was taking care of the mind, they were taking care of the body, and I wanted to take care of whole people. So this is later in life as a mom with an infant. I'm going back to school, basically starting over to get a whole nother education. And I did. I went back on the family track. I knew that to be able to provide behavioral health and mental health services in a primary setting, I needed to be able to also provide primary care. So that's where patients have access to providers. So I was on track. I finished my doctorate. While I was doing my doctorate, I was recruited to teach psychiatric and mental health nursing at the medical university, and also work to facilitate interprofessional education day, where we had discussion groups with students from all of the colleges on campus at the medical university. I loved those conversations to really help the students appreciate the contribution of each of these different specialty tracks. So I loved having the conversation more collaborative in caring for a patient. But I'm teaching, and my practice site while I was teaching was in the homeless shelter, in the medical clinic at our local homeless shelter. And I started a clinical rotation to allow students to rotate through under my supervision and provide integrative care. Such a vulnerable population in desperate need, not just of primary care, but certainly mental health care as well. If they weren't depressed or anxious before they were homeless, they are now. So it was an opportunity for patients to really, for students, healthcare students, to really start looking deeper, going between the lines, looking beyond sinusitis, looking beyond, any of the health concerns that bring someone to the table. They will come to the table when they have a fever and they're not well, but they're not going to necessarily bring their anxiety, depression, vulnerability, PTSD, panic disorder. They don't wear that badge as willingly. So I loved my work in this capacity, but I knew that I had not done my doctorate to teach. I had done my doctorate to care for patients in a more holistic way. So when I continued teaching for about a year after my doctorate was completed, and then I knew I had to go out and get some generalist experience myself. So I did. I jumped into urgent care thinking, all right, this is great. Whatever comes at me, I have to roll with it. And it was fantastic. It was cardiac workups. It was suturing lacerations. It was, physical exams. It was a little bit of everything all day long, which was fantastic experience. And then, 2 years in, COVID-19, this novel virus rears its ugly head. And then healthcare went from, 20, 30, maybe 40 patients a day, urgent care, rapid fire, anything coming at you, to 50, 60, 70 patients a day. Then it continued on up. And remember, this is me coming from a background of having 50 to 60 minutes at a time with a patient and really loving, more than anything, asking the questions, how are you doing with this? Or how has this created stress for you? Or, how are you managing this? Really, how's it going? And so here I am just keeping up with the volume of a pandemic. And on my highest day, I saw 130 patients by myself. And it really was the most ungratifying experience of healthcare. And I know that can have a response. People might think, well, was it supposed to be gratifying? No, but it was not healthcare in so much as it was addressing and providing compassion for a sufficiently traumatized community from the media coverage of a pandemic. So here we were. It was the end of a 12-hour shift, and it had been swabbing noses all day, every day for weeks and weeks on end, months on end, going into the second year. And a patient comes through at the end of the day, and she was not there for COVID testing. She was there in need of her doctor to show compassion and to be there for her in a very real human way. She was grieving. Her father had just died, and she wasn't worried about COVID, but she was struggling, and her daughter was bearing the symptoms of her grief, her complicated grief response. And there was nothing left of me to give at the end of this day. There was nothing left. Emotionally, I was completely tapped. And I did what I could for her. And I made sure she would come back, and I, got her started on an antidepressant. But the way I needed to be there for her, and the way I had prepared my whole career to be available to someone, I couldn't do it. And I drove home that night in tears, feeling incredibly disappointed and ashamed in myself. And I knew that everything I had prepared for was that patient. She was the patient I was born to take care of. And it had motivated my entire career to this point. And then there was nothing left of me to give that night. And that to me was a wake-up call. That's the devastating wake-up call that burnout provided me. It was, how far off the rails have I inadvertently gone? How far have I strayed from my purpose? And in our stress, in our survival mode through a pandemic, we were just getting through, just pushing through, and day in, day out, patient after patient, get through. The physical, emotional, spiritual exhaustion that characterizes burnout had set in deeply. And this wake-up call really prompted me to take a step back. And I went to my employer and I said, I need to step back. And they said, no, revenue's up 270%. We love this. This is great. Keep going. And we had to keep going. And I said, okay, I cannot expect anyone to honor boundaries that I haven't clearly set. I've been willing for over a year to just crank this out day in, day out. And so why would they expect anything different? And why would I expect any different now? And so it necessitated a resignation. And I did. I resigned. And then there was a little bit of a fuss in trying to stop me from leaving. But I knew this was so far from what I had ever gone into healthcare to do. I had to step back. I was considered the expert on burnout and compassion fatigue when I was teaching at the university. But now it was beyond didactic. It was beyond academic. It was very deeply personal for me. And I realized how much I didn't know about burnout. As much as I knew, I now understood there was a whole nother dimension that I needed to understand. So I set about to do that, to really thoroughly understand burnout better than I ever had as the expert at the medical university. And I did. I set out, and we can go into that, but it was very real, very personal, but it required that kind of wake-up call for me to realize I don't even know if HIPAA were not of consideration. I'd love to write a thank you letter to that woman, and I believe there are angels all around us, but it's like, who helped whom that evening? You know, I've never seen her again, but I wish she knew what she did for me. So what it precipitated was an unbelievable blessing.
You know, I applaud you for stepping back, right? I mean, we're in a crisis of our healthcare workers, right? So at Sophia Health, we have an employer program. So we provide health and wellness to large employers, large healthcare systems, about 10 or 12 at this point. And they are all struggling with this employee burnout in this healthcare system. You know, it's a crisis, it's a pandemic. So I'm just curious, like, well, I see how we got here. I mean, the fact that you went into your boss and they said revenues are up 2%, I find that a shocking response, you know, but it's just devastating to hear. But I applaud you for stepping back and setting your boundaries.
Burnout, we all think of it as exhaustion, and sure, that's a part of it, but it's not all of it. So no amount of downward dogs or lotus position or meditation is going to do it for you. Okay, that's only a part. Now, the way the World Health Organization characterizes burnout is a occupational phenomenon that is three-dimensional. And those three dimensions are depersonalization, where we disconnect from the personal meaning of the work and our personal calling to do the work. The second dimension is exhaustion, and that is physical, emotional, and spiritual exhaustion. And the third is a diminished sense of achievement or a diminished sense of accomplishment. Some self-doubt sets in. And so these three dimensions, I set out to find the antidote to each of those, knowing that, okay, so if exhaustion requires physical, emotional, spiritual rejuvenation, that means, yes, we need healthy nutrition. Yes, we need some exercise and sleep. I'm forever championing sleep. That's my big mine, if I sit on one soapbox, it's the need for restorative sleep. But that's still not enough. It's still not enough. And so I wanted to understand fully the antidote to each of these dimensions. So depersonalization, a disconnect from the work, that requires a realignment with one's purpose, clarification of one's personal values, because very often we're operating on default values that we held 20 years ago when we went into the profession. We haven't actively re-clarified or reevaluated our values. It may be when you went into healthcare, let's say when you start as a nurse, maybe you're young and fresh out of school and willing to do the night shift, willing to pick up another 12, willing to do back-to-back-to-backs because, you don't have children yet. You don't have a family yet. This is the start of your career and you'll never be more energized. But then 10, 15, 20 years down the road, there's still the expectation that you'll pick up that extra shift. You'll stay late. You'll come in early. And what I've really discovered in looking at this first antidote, the realignment with purpose, is that there's a rub, there's a real friction between the younger generation and the older generation in healthcare. And the older generation is thinking, well, this younger generation just doesn't have the same work ethic we do. Why aren't they picking up extra shifts? Why aren't they staying early or staying late or coming in early? And then I step back and I think, this younger generation is setting some serious boundaries, and good for them. Good for them. Just because they won't compromise their own well-being for the job, it doesn't mean they have a diminished work ethic or any less of an employee or a value to the company. In fact, they can be more because they're taking the time away from work. They are making sure that they leave work when it's over and they are there when they're there. So I've discovered a real rub there between, boundaries. Is it boundaries or is it work ethic? And the ways that we look at things needs to shift. So then for the second dimension, which was exhaustion, really beyond self-care, what it requires is restored passion. Passion is energy, and we get energy from all of those things, from exercise, nutrition, sleep. That gives us energy. But really we have to also tap into what activities in our day, what habits in our day-to-day activities really fuel us, really give us energy, restore our passion. And that's what is the antidote to exhaustion, is having passion. When you discover something that you love doing, the hours will pass and you won't even know you're still sitting there. And I found pouring myself into burnout, I've never in my life been a morning person. And I found when I was pouring myself into this research and understanding so much more, I was up before the alarm. I was up long after my shift was over and long after my child went to bed. I was taking whatever moments I could find in between patients. The time, I just couldn't get enough of it. And there was a tailwind and it was a passion. Those activities in your day that you feel that time stands still, that's a good clue from the universe that those are the activities that are in alignment with your purpose. And those are the areas to lean into. Include more of those in your day-to-day activities. And that's where something like a habit tracker and a habit plan can be so helpful. Because when you recognize, well, this really fills my cup, I'm going to make sure that I add more of this in my day-to-day life so that I am working in closer alignment with my purpose. So that first one was purpose alignment. Second is restoring passion. And the third is that diminished sense of accomplishment or achievement. And that the antidote for that, to me, is reclaiming our power, reclaiming our voice and our power, and recognizing how much it took for us to get to where we are in our careers. I love taking that opportunity to update your CV or, write out a job description. I know that employers might not like hearing that, but to fully appreciate what it would take to replace you, I think everyone should exercise that. Everyone should stay really closely in touch with not just the academics or the certifications or licensures, but the life experience you bring to your work, the insight you bring to your work, the heart and soul you bring to your work. And that's where we forget that, especially when we're underneath the weight of the work and we're not in alignment, we're just a little disconnected from everything. We start to doubt that we were cut out for this work, or that you're where you're supposed to be. So those are the 3 antidotes. Then I wondered about an insulator. How do we insulate ourselves from burnout? And that's where really diving deeper into what I call boundaries, and then also a rebranding. You 2.0, it's a reboot, it's an upgrade to your own operating system. But we've got to set the boundaries, learn what they are, and practice them, because that's where the breach happens. That's where we find we're filling a bathtub, but the drain is open. Those little parts in our day that can just add up and tap us of everything we have.
You have just spoken the words of my heart and my soul. And I know that so many of our listeners are going to resonate. And I know, like, coming from a background of being an educator and then being in the health and wellness profession now, like, burnout is very real, and it just applies to so many people. And I just thank you for that. I mean, just hearing you describe burnout is like, it's once you get to a point of like survival and you're no longer in alignment with your purpose, your values, your priorities. It's almost like you had the best of intentions. You went off on this beautiful hike, and somewhere along the way you got lost on the trail. And now you're looking around, you're exhausted, you're out of materials, and you don't know where to go next. And I feel like so many of our listeners can profoundly resonate with that wake up call moment that you so vulnerably shared with us, where it's like, you get hit with this realization of like, why am I here anymore? And to your point, it's like, there's almost like shame and guilt and this terrible guilt. And it's like, how am I not able to continue to do this? Everybody around me is dealing with this. Why do I have the problem? Or so on and so forth. And to your point, some of our employers, or some of the relationships that we've formed over the years through our careers and professions and these different roles that we align to, is it leaves us wrung out. Like, you can't absorb anything else, right?
Yeah.
And so I think that depersonalization, the whole person exhaustion, and then the diminishment of achievement is huge. I know, especially when I was an educator, I constantly felt like I was being punished for doing a good job. It was like, we'll just keep throwing more at you. We'll just keep throwing more at you. And that just resonated so profoundly.
Yes. And I think that's the sad part is, when I feel like nurses, personally, I feel like nurses are the canary in the coal mine. And that to me is the saddest statement, when a society would make caregivers the litmus test. That's the canary in the coal mine. When we would sacrifice caregivers, it's a big statement on values. It's a big statement on where we are. And I think that to me was as big a wake up call as any, is that our caregivers, it's healthcare that's being completely sacrificed here. And I get it. It's a pandemic. It's a global health crisis. So healthcare is called to arms. But the way that it was done and exploited, the way that a pandemic, a public health crisis, was allowed to be exploited, and a big part, now this is also potentially controversial, but a big part of the problem to me is that it's a for-profit industry. And I don't believe anyone should profit from another's dis-ease. And it's a for-profit industry. Why would they allow me to take care of me when profits were up 270%, when revenue was up 270%? I mean, there were vacations to take and private schools to pay for. There's so much. And still, I'm getting home at 9, 10, 11, trying to cook dinner for my child and help with whatever I could with homework. And healthcare got sacrificed through it all. And I don't just mean just Western healthcare. I mean, anyone who truly prioritizes well-being and who is in a service field or wanting to care for their fellow man in any capacity. I think that's where there was a real exploitation that I think we need to hold people accountable for the way this was handled.
Yeah, just so our listeners have some understanding of what we're talking about here in the scope. So this was only one study, just looked up quickly, from the Journal of General Internal Medicine, over 500 healthcare workers and first responders. Okay, this reports substantial reportings of clinically significant psychiatric symptoms. That includes post-traumatic stress disorder, 38%, 74% reporting depression, 75% reporting anxiety. And this is the saddest of them all, but recent thoughts of suicide or self-harm is 15%.
Yeah.
Those numbers are disturbing. So that's not just, we're talking first responders, healthcare employees. That in of itself is creating a crisis, with burnout. And to your point, I love the fact that you make it cool. No matter, you can do yoga and we can introduce meditation into this, but it takes this whole person concept. Is this cultural? What do we do to induce getting back to this value system and finding this passion? This is hard.
Well, it's hard, I'll tell you. And that question, I've also, over the past year of doing this work and creating a course and creating materials to share, I realized, okay, if I was the expert and I still had blind spots and I was still vulnerable, what about people who aren't the behavioral health guru, that aren't, that aren't sitting on 20 years of therapeutic resources that they can tap into? So I wanted to, right, that's where.
What your healthcare, we find in these studies, these healthcare employees are going to be the last ones to go and ask.
That's right. It's expected that they know the answer already. They are the ones caring for everyone else, but they're not asking for help. And I did find that because initially all of my work, I thought I was making this available to healthcare. And it was, I threw it out there to the world and it was like crickets. And I thought, is this a pride thing? Why are we not willing to receive help if it's there? And yes, it is. There's an expectation that they're supposed to already know it. Don't show weakness or, you're less than. But what I found through this whole process, a year of looking deeply at burnout, is that it's really not an occupational phenomenon. To me, it is a cultural norm. And that is frightening. When that's the expectation, is that you are going to pick up the extra shifts and not set boundaries and burn it at both ends and work the 40, 50, 60-hour weeks. We martyr those who do. So if you look at the number of people that are coming into primary and urgent care settings as adults seeking Adderall, never diagnosed with attention deficit, what if they actually just got some sleep? Took a vacation maybe? What if they ate better? What if they got some exercise? What if they actually did realign with their purpose? What if it wasn't just a matter of, I'm going to get a raise. I'm going for this raise. So I got to show my boss I'm going to pick up 2 more days this week. I never stop. I'm just going to, power through. More caffeine, more Monster energy drinks, more Adderall. But it's a cultural norm now. Burnout is just something we've accepted.
In the healthcare system, I think that we're also looking at, okay, we're primary care, we're this healthcare system. And then when we're talking about all of these wellness initiatives and, it's beyond self-care at this point. We understand mental health is not a walk in the park. We understand that you have to actually take care of yourself. One can speak to boundaries and setting expectations. But I don't feel like these two worlds have really integrated in an amazing complementary way. So I think besides the fact that there's the cultural norm, we have I'm in mainstream medicine. I am the nurse. I am the doctor. I am the one that prescribes. They're not, for them to turn around and then say, I'm going to meditate and take this internally and take care of myself and prioritize my health. So I think there's like a disconnect here that we're looking at that is beyond a cultural into this. And I'm only speaking what I've seen on the health.
No, you're absolutely right. And truly, healthcare is not healthcare. It's sick care. No one comes when they're healthy. It's not how it goes. Wellness has become this whole new industry, which I love, but I don't think the average consumer of healthcare in this country knows what to do with all of this. There's too many options now, and they just want to feel better. And so what the insurance will cover is primary care, and that is Western medicine. And now if you listen to Fixing Healthcare as a podcast I like, and these are some old school MDs that are talking openly about how it's part of the training. in med school, to be stoic, to maintain a wall between you and your patient, erect a wall between you and the patient and maintain your distance. Well, if we now know that depersonalization is one of the dimensions of burnout, and we're training doctors to depersonalize, it's a setup. It's a terrible setup there. It's a recipe for burnout. And I think that we've got to start asking these questions about, and there's a wonderful study. It's called The Devil's in the Third Year. And it is about, in the third year of medical training, we see a marked decline in empathy in medical students. And that in that third year is right when they start rounding and putting hands on people. It's less didactic. It's more clinical. And that's what's frightening, is that's when the wall goes up. And sure, there's a protective mechanism there. There's a survival mechanism in that, because yes, you're going to deliver some difficult prognoses. You're going to deliver some difficult diagnoses. But still, if healthcare isn't personal, what is?
So I can't speak to medical school training. I only was a combat medic, so it's kind of a CNA and an EMT. So I did that for 7 years, actually in the Air Force. So can't speak to the medical side of the house, but it's just mind blowing, right? And I think also what we're looking at Sophia Health, bridging these different practitioners together, especially bringing on the different health coaches and how we set things up. People don't understand what to go to look for. They're searching symptoms, the depression, anxiety. But in the nutritionist realm, what we've seen, and the health coaching realm, they can really help out. And I'm super proud, after retiring Air Force, the VA is really looking at this holistic model as a system. How do we provide whole health and actually take in all of these different components? And I know that there are CPT codes there. The AMA is actually looking at health coaches to help with this, even if we have to get the payers to get on board with some of this preventative health measures. So I'm super proud of where things are going in this space. But to your point, it's not there yet.
Not there yet. And it's a journey. It really is. I think we have to educate the public as much as anyone else, as we started talking. And through the pandemic, I can look back now, and personally, burnout proved to be an incredible blessing and gift. I think that this pandemic we can also find a silver lining if we can now let this be the catalyst for change that we've needed to see for a long, long time. And we're waking up to how we're working. And I firmly believe that change at the individual level does ripple out to affect the whole, and the system can change. I believe qualitative systemic change is an inside job and always will be. Because if one person at a time realigns with a sense of purpose and holds on to their passion and is proud of their achievement and owns their voice, uses their voice, I think we can make a huge difference, one at a time. One of us, we are each the first bite of the elephant. I like to think that this is it. You're the first bite. So how do you make some change internally? And it does ripple out to affect the whole.
I just feel like that's such an empowering statement to make.
Well, I think too often we look at it and we think, well, how am I going to go up against healthcare? I mean, this is a huge broken system. What can I do? I'm just me.
Well, what you mentioned earlier, you're looking at the generation, right? So
yes.
You have a generational divide here where this used to be the cultural norm, but you already said it yourself. And Lauren and I were just discussing this topic. So please jump in, Lauren, but maybe Gen Z is not on board with this. Maybe they have figured out early on to set the boundaries, so maybe we're looking at them and not really understanding and relating, but maybe they're here to say, we're not standing for this. They're more open to talking about mental health and issues.
Yeah. And I think too, it's so interesting because even prior to the pandemic, we saw this massive polarization around generations, like where it was like, okay, the baby boomer generation has these types of external validations of success that were superimposed on millennials. And then it was like, okay, millennials went and did the things. And then all of a sudden we're seeing this like shift for remote care and remote work and all of these different things from the millennial perspective. But, now we're seeing like, oh, maybe it's not a midlife crisis and a quarter life crisis. And then welcome in the new generations of Gen Y, Z, and all of these younger generations coming in, where it's like, we're being called to innovate change, because at a subconscious and a collective conscious level, we know that it's broken. And I think that we have gotten complacent from a cultural perspective of accepting what is, right? It just drove me nuts where it was like, well, if it ain't broke, don't fix it. And it's like, but that doesn't mean it's not cracked or like potentially going to get worse or whatever it might be, right? Prevention, not reaction. And I just think that to these younger generations, to their credit, they really have been tested in the sense of it was very polarizing. Like they were characterized in such a negative light where it's like, no, maybe they just figured it out sooner than the rest of us. Like due to technology or what, just being more observant, coming from a cultural birthright of social media. All they do is observe the behavior of others from their phones and what have you. So I just think it's so profound that I think that we're being called to this change. And to your point, I think mindset is such a key asset where it's like, well, I'm just one person. Somebody else will have to do it, or it's the next generation's responsibility, or this problem isn't mine. And listening to you describe that, where it was like, well, no, it's this ripple effect. The vision of almost like, okay, like one raindrop on a barren piece of dirt isn't really going to make a difference. But if we have a monsoon of all of these individual raindrops falling, like there eventually will be a flood.
Absolutely. And that's how it starts. That's how it starts. There's one raindrop, but I think we have to let it be okay and empower the individual and really allow them to see the impact that they do make. Just the way you show up, not just at work, but the way you show up in every relationship you have, every interaction you have. That's something that's, I think, needs to be part of the conversation. Is we're so busy. And for the longest time over the past decade or two, there's been a push toward, there's a movement of and a focus on diversity and inclusion, which I love the intent. But what we've created is a lot of divide, a lot of division and separation. And I think if we can unify, I'd love it if we and us were the only pronouns used and the only ones taught. If we recognize that underneath all of these beautiful, beautiful idiosyncrasies and these unique qualities that each one of us has, I love, honoring the individual. And if we could recognize that underneath it, we are human beings, every one of us, and that we have a common cause, and that if we can unify, think how much greater and more powerful we are if we were acting in concert, if we were working together. And that's where I think it's counterproductive to be, insisting upon everyone honoring these differences, this label or this. I think that it's pushing us farther and farther apart. And the force we could be, the force for good that we could all be if we were more unified, if we recognize that all of these differences are what make you so uniquely you, and it enriches us. For you to be uniquely you, it enriches us. And going back to purpose, what I firmly believe when someone says, well, how do you find your life's purpose? How do you realign with purpose if you're not sure what that purpose is? Well, I believe our purpose is in actualizing the full potential of the gifts that we are uniquely given. I think each one of us does something uniquely well, whatever it might be tying a shoe. It might be whatever it is. But your calling is somewhere in that. We are each uniquely gifted and we do things uniquely. That is a good indication. Lean into that because your purpose here, that's what you are contributing to the whole in such a beautiful, beautiful, individualized way. And that's where I think the habit tracking and the habit plan, if you can identify those activities that you just get lost in, lean into that. Find your purpose and your passion that way. Because that's when you know you're in alignment.
Oh, wholeheartedly. And I also, to add on to something else that you had brought up previously, really getting honest and crystal clear about knowing your values and your priorities. Like so many people feel like this wake up call are these moments of like, I don't recognize myself in the mirror, or I want X, but I'm at A. And it's, meditating or going and doing all of these things for temporarily, if it doesn't align with your values or your priorities, it's never going to be sustainable, right? So to your point of leaning into these habits and these tracks, looking honestly at why you make the conscious decisions and unconscious decisions that you do. Like if you value your physical body's wellness and eliminating pain in the body, what do you need in your daily habits, rituals, and routines that supports that value? Because more than likely, to your point, you're going to find that you're in survival mode and you're not doing things that are supporting your value system, or, and more than likely, to your point around finding your purpose around the things that you lose time in and the things that fill up your cup, more than likely those things are going to be supporting your values and your priorities.
They absolutely are. I love to use what I have, and I've got this prototype in my head, but it hasn't materialized yet, but I have what I use, and it's called a values filter. And when I have to make any decision, I run it through a filter of my values. And when you're crystal clear on your top 3 values, it becomes really easy to make decision. It becomes easier to set boundaries. If you're asked to pick up a shift and you know that your number 1 value is time with your family, it's really easy to say no if I know I'm sacrificing my number 1 value, my time with my family, by picking up this shift. Sure, the money would be great, but is it in alignment with with what matters most to me? So the values filter just gives you it really takes it off of you. You don't get hooked into they really need me or any of that. You're not going to sacrifice what's most important to you. You won't do it. And that's where you can just clearly say, and then, clearly speaking your truth. You know what? Time with my family is number 1 for me. So I'm sorry. And best of luck filling that shift, but it won't be me tonight. Thank you. Move on from that and know that you honored what's most important to you. You honored your values. You'll never regret that. So I think that we have to let values guide boundary setting, decision making, because you're right. If you are picking up that shift and you're sacrificing your family, you resent that shift. You start resenting the job because it's compromising your relationship with your family, your time with your family, the health of your family, and that's most important to you. So the resentment starts to chip away at the pride in what you do. And really, a lot of people think, well, I just need to find a new job. Well, no, you can find a new job, but you're going to take that same system with you. You're going to just burn out at the next one unless you are going to really stop and do the inner work of knowing your purpose, knowing your values so crystal clearly. And in that example from before, as a nurse at 20 or 25, family wasn't number 1. Maybe making a lot of money was number 1, and you were honoring that value when you were picking up all those shifts. But now you're 35.
That's right. I was about to bring that up and say, I think that we have to delineate between when we're looking at this here on one side of a career versus you do need to put your time in sometimes, pay your dues. Like we can't just say, I'm going to start out, be 18, go to my first job, and no, I'm not going to work. No, I'm not going to do anything. So I think that we need to be very clear on, at what point, like you were just saying, the 20s, the 30s, you do have to work to get the seniority, to get to have the say-so in some of these ecosystems.
Here's the problem. The better we get at our job, the more we're doing it on autopilot. And we stop checking in with our values. We stop checking in with things. It is my mission not to do anything on autopilot. I want to pulse through it all. I want to know what I'm doing and that it is in alignment. And that's idealistic. But I'm a little bit of an idealist because it's your life, right? And it's how you spend it.
You only get one.
You only get one on this plane, as far as we know. So how you spend it needs to matter. And no one is responsible for meeting your potential except you. And no one can do it for you. No one can do it for me. So to really live and use my gifts to their full potential, I have to be mindful of how I'm doing it. I have to stay in touch with my values and my purpose. And that young nurse at 25, that was number 1. New nurse, new career, loving it, maybe paying off some student debt, doing the time, maybe climbing the ladder and taking on more managerial roles. Now at 35, maybe she's got a spouse, maybe she's got children, maybe she's got an aging parent. And now the values, unless you check back in, you're just so darn good at your job that you haven't paused to figure out, am I working in alignment with my values? It's not the work that's changed, it's your values that have changed. So we often demonize the job or the work, and we think we have to jump to a different career or a different job in the same career. But we have to stay in touch. The inner work is where you make sure that you're working in alignment. And you can do anything. I mean, you can change careers if you want, but make sure you're doing the inner work as well. Because, stay aligned and stay in touch with the values so that you can enjoy the work that you're doing.
Yeah, I love that we've looked at burnout and saying it's more than just this physical exhaustion that we all assume that this is. So we have to bring in these value systems. What can we put in place? Because what we're talking about here is prevention versus a reactive system.
Mm-hmm.
But circling back to this, let's just say there's a lot of people who haven't gotten to this awareness and to the Dr. Kimbi understanding of, burnout is more than the physical, mental, emotional. We have these other components. But what are some of the signs that you saw people hitting? I mean, I know you spoke to yours a little bit, but are there signs that people can say, this may be burnout?
Well, of course, it's when we think about depersonalization, that's when you're just, starting to think it's really, I don't know if I'm cut out for, you just start to think that I don't know if that's really important to me anymore, or, I just don't even care about their problem. I don't have time for this. There's 8 other patients waiting for me right now. Let's just cut to it. Let's just, and I'm speaking about healthcare. But when you start to realize that what you took great pride in earlier on, what you loved doing and wanted to do well, you now are just doing it to be done with it. Just knock it out. You don't even care the quality of the work you're doing anymore. It's just get the work done. Move on. Next day. Of course, the physical, emotional, spiritual exhaustion, that's when you start to realize you're not sleeping well. Maybe you're drinking a little too much. Maybe you're doing other coping, negative or more dysfunctional coping. Maybe they are just behaviors that started being relatively benign, maybe a glass of wine after dinner or after work, and then it became half a bottle, and then it became the bottle. Or, more people are, using recreational, a lot of cannabis, a lot of, we're seeing lots and lots of coping mechanisms that are like, for some people, they're even over exercising. They're trying to get the work in, and then we're seeing more stress fractures. And really when you pause and really start to talk to people, you realize they're coping, and this is coping gone haywire. And there's no wrong or right way to cope until, it starts out as physiologic and then it becomes pathologic. And when whatever the coping mechanism goes from physiologic to pathologic, that's when we know that it's no longer working for me, it's working on me. And we have to make sure that, if you're drinking that wine, make sure it's you drinking the wine, not the wine drinking you now. And make sure that, you're on top of what you're doing. Know that it's coping and pause. I think that it's all about insight and looking at our behavior in a very honest way. And really, I wish there would be less judgment of each other. In my perfect world, right? People could come to you and say, I think I'm drinking too much. There's judgment and shame in that. And really, they don't get the help they need. They're coping how best they can. Maybe they can't unwind when they're going on cortisol, just in survival mode. And to really unwind, they need something to help them. The number of people, like I said, on stimulants to stay up, well, it's just as many people on depressants to bring them back down. And so, or to sleep issues, big problem. But our minds are continuously going. And so people are leaning into whatever resources they can find to prop themselves up and to help themselves crash. The signs are there. With the diminished sense of accomplishment, that's when you start really, you're just thinking, yeah, this really, I don't know, maybe I should have just stayed. I remember long before healthcare, I was a vocal performance major at NYU. And I remember one of these days at urgent care during the pandemic, I remember thinking, man, I should have just kept pounding pavement in New York. I would have eventually gotten the role. I would have eventually gotten the gig. And, you start, but you know what? I know what I bring to my patient-provider relationships. Patients know that no matter how long they waited, when I'm in that room with them, I am fully present. I know the heart and soul that I bring to my work in healthcare. I'm a good doctor. And yet I questioned that. I questioned it. I thought I should have kept pounding pavement in New York. And that's where, you start to think, wow. I mean, that's how far off the rails you have gone. And these are the three dimensions. I think people being aware of the three dimensions of burnout can really start helping them hold a mirror up and see what is a reflection of their own experience of exhaustion, their own experience of diminished sense of accomplishment, their own experience of depersonalization. Each experience it differently, but I think that knowing awareness is key, and self reflection is also key, and be able to take an honest look and then have someone that you can go to and say, what do you think about this? I feel like it just doesn't feel like it's the best thing for me to be doing right now. And yet I don't know how to stop.
Yeah, I think awareness is the first step in no matter what issue we're talking about. And then you have to be accountable to yourself and take responsibility, whatever that resource is that you're looking at. If it's online, virtual, go to the doctor, whatever you have to do, go to a platform like ours. If you have to find that practitioner and get help, but you have to be aware of the issue and then be accountable.
Right.
Yourself.
And I think that really here's an opportunity for the employers. This is a huge opportunity. If you value, because how much money is spent on hiring a new employee versus retaining a good one? If they were more invested in preventing burnout, in making people aware, creating the employee assistance programs that are focused on burnout prevention, and looking at, what if we were really building each other up? One really positive thing about this movement towards more health coaching and just coaching at, the industry of coaching booming the way it has. On one hand, I think that's fantastic that we could be building each other up, lifting each other up. Think of what a coach does for you. If we were all doing that for each other, how powerful would that be? But then on the other hand, there are worries that are all of these coaches really qualified when someone comes to you and there's actually some trauma or more going on, So I think we have to be cautious about, just leaning into health coaching. But I think that employee assistance programs and employers could really be providing resources in a powerful way that could ultimately save a lot of money, because you're less focused on constantly hiring new people. What if the focus shifted from hiring to retention? And it was really based on let's create a healthy environment for people to come to work. Let's let it be okay for someone to come to you and say, I'm really burning out. I need to step away. How about have the resources in place, not just to say, nope, are you kidding? I love this revenue increase. What if we actually said, let's get you through to talk to somebody? Or what if they called and checked on you the next day? What if they said, I'm going to find someone to cover that shift for you. I want you to step away, and here are some resources that we can help you with. If we did that more, if employers would embrace that, I don't think people would be, because it's short-sighted and it's really a defense mechanism to just jump from job to job to escape, when really there's so much more that employers could do.
Absolutely. I'm really proud of all of our partners in the VA and the VA healthcare systems that we support with our employer program, who've really leaned into this, and they're actively, a lot of these healthcare systems are actively doing something about it. So I'm really actually proud of that. But I agree, there's a lot more employers who could be doing this to support their employees. But like you said, it comes down to there's the cultural aspect, there's the actual class aspect. And then there's the transparency and the quality, right? Which is something we're super also proud of as Sophia Health, is in this world of wellness that's popping up and everybody can call themselves any title they want. Where do you start bringing this transparency and this apples oranges comparison when the titles range all over the place? The titles can change from state to state, coast to coast. How do you know what you're getting at a consumer level? And how do we get from, this wellness industry, this wild, wild west, to no, this is this is legit. This is an industry, and there's a lot of professionals in this industry that can help you, in a lot of different ways. And we just have to bring a lot of transparency. So I'm really proud that we're able to help support that. So you can see all the different education, certificates, license that all these different practitioners have, because they do. But a lot of times this isn't known in this industry. So I think that having a lot of transparency and insight into all of these backgrounds is key for this to be sustainable changes for consumers, for individuals.
Definitely. And working together. I don't know everything about everything. I can generally find someone who does. And if we recognize it's an abundant universe and we are all served by helping each other, it serves you to help me and it serves me to help you. If we were really recognizing that I'm bringing my gifts to the table and you're bringing your gifts to the table, we are uniquely contributing to the wellness of our community. And that's where if we could work together, and yes, transparency. So somebody's not trying to be all things to all people. If we could let you be good at you and then lean on me if I can help.
I mean, how powerful would that be? If our doctors and nurses and health coaches and life coaches and nutritionists and functional medicine, insert title here, could work together. What if the nutritionist could work with your physical therapist and create these amazing programs for people for pregnancy? The potential when you work together is unlimited.
Well, and I think it goes back to like changing the norms around the way that things have been done. It's a very naive and childish notion to think that you are responsible to find the one multi-purpose tool that will do everything for the rest of your life when it comes to your well-being, your career, whatever it might be. And I think that as we continue to grow up and take accountability for ourselves and build that awareness, that self-reflection that we're talking about, like the key understanding is, yes, we have to know ourselves profoundly better than we are accepting at currently. But I think the bigger picture aspect is we also have to understand that it's a team sport. Life in general is a team sport. So I might know my role on the field of life is X, but I also have to know how I'm supporting my other teammates and how my teammates support me and how my coach, whoever. There has to be this big shift. But I think that I just loved what you had said earlier around where it's like, yes, self-awareness, self-reflection, accountability. Yes, I'm all in on all of those things. But I think the way that you had spoke briefly on like insulating against burnout, right? Like it's one thing to understand it, to know it and to address it, but it's another to prevent it, right? And so insulating and rebranding yourself, you 2.0 is what you said. And I love that. And I was like, what would it look like if not just employers, but if individuals sat with themselves and asked themselves, have my values changed? Has my goal changed? Am I in autopilot? Am I growing or am I stagnant? And it's like just giving yourself the compassion and the liberation to just grow and accept that you're going to be in a different season.
That's right. Well, and that's where, again, the individual is so powerful because it does ripple out. And that's why systemic change is an inside job. And it starts at the individual. And that's where give yourself permission to pause and look, check in, take a pulse. And you 2.0 is we think about operating systems. How are we operating? Am I on autopilot? And think about, okay, the rules of engagement with my job, with my family, with my children, with my, you name it, fill in the blank. You can recreate this. And the minute that you get really clear on your values and aligned with your purpose, there is a shift. Everything shifts. And especially, and I truly find that as I'll figure out a way to create my values filter, but it really takes that. It really removes any of the guilt or shame or any of the personal. You really, really are given permission, especially because you're not going to sacrifice your children. You'll sacrifice yourself all day long. That's how you got here. But you're not going to sacrifice your children and your family. So really, when your values are at play and when they are the consideration for every decision you make, then really it makes boundary setting that much better. And staying in touch, implement your own system. Self-charting is another practice that every day, even 2 to 3 minutes at the end of your day to check in. And I use a little journal, and I've got this little rating scale of, 1 to 10, and I rate how aligned did I feel with my purpose today? How did I have all the energy that I needed for my work today? Am I proud of my accomplishments today? Those 3 scales allow me to check in on my purpose, my passion, and my power. And it took me all of 1 minute to circle a number in those 3 categories. But what it required was for me to reflect on alignment in each of those categories. And right there, that's one way of staying in touch with those 3 dimensions. And those are the buffers. And then implementing a values filter, or finding a way to really practice healthy boundaries. And then, yes, create your own system. Let there be a way that you make decisions. And that's your operating system. That's how you operate. And if you are operating with very clear values and your life's purpose, then everything moves you in that direction. And it's limitless. The possibilities are limitless, as you just said. I think that there's so much more that people could be experiencing fulfillment-wise. It's not just about a race to the finish line. My father was a psychologist and an author, and he used to say to me, getting there is called death. So slow it down. And it's true. You're supposed to be enjoying the journey. It's not just a race to a finish line. And if you get there, then what? The number one regret of the dying, as we all know, is not allowing themselves to be happy. I wish I had allowed myself to experience joy. I wish I had allowed myself to be happy.
I think you summed it up beautifully, right? Check in with yourself every day on your scale, passion, purpose, and power. And you have it from Dr. Kimbi, everybody. Dr. Kimbi, thank you so much for being with us. We do have one more question we like to ask our guest. But if you could tell us, what is one misconception about living well that you wish you would have learned sooner?
Probably what we just were saying there, that it's a race to some place, that wellness and joy and happiness is somewhere off in the distance, that it's right here and right now. And this is what we have. And this is what matters. And so I wish I had understood that, because it was always some far off place. Once if I lost 10 pounds, or if I got that promotion, then I'll be happy. Or if, when I get the house and the car and the husband and the kids, and, then I'll be happy. But happiness is right here and right now, and we carry it forward. And it does, it's exponential if you carry it forward with you. So here and now is what you have to work with. Stay present and treasure this moment right here.
I agree. You said that life is enjoy the journey. There's no magic finish line to the end, and you get there and then you wish you had enjoyed the ride.
Right. And too many people put it off.
Adding in happiness as one of your values.
Mm-hmm.
I am a happy person, not I'm happy if X condition is met, right? Like happiness should be one of your values. So when you're using the filter, you're like, yep, maybe I should recheck that. As you were speaking, I was like, I need to do some journaling about this later.
Or let it be one of your values. Put it in your operating system too. Decide that happiness is going to characterize every interaction I have. And I know firmly that very often when I see a patient, someone will come to me and say, "Ooh, this person's really grumpy." I will tell myself, nope, it's a blank canvas. I'm going to walk in there not with anybody else's experience of this person. I'm going to walk in and hold the space and interact with this human being brand new. And I know that I might be the only moment, the brightest moment in this person's day. So I'm going to do my part here to show up and allow that to take place, this exchange. And I think especially, just one last statement on the pandemic, is that what I walked away from is that really human connection is so incredibly important and powerful, and we cannot take it for granted. The amount of isolation that we saw and the suffering that we saw through the pandemic, some patient stories that will forever stay with me. But we have to recognize we are social creatures, and there's so much more we can do to lift each other up. I'd love it if we could shift as I said, my ideal world, we work toward unity. We and us are the pronouns we use, and we are unified, and we are making this world a better place together. So human connection, it's the most powerful thing.
Well, Dr. Kimbi, thank you so much. So if our Sophia Unfiltered listeners want to connect with you, what social channels would you like people to use?
Oh, sure. Yes. Well, you can go through LinkedIn or Facebook. I haven't embraced many of the other platforms, but my website is also a great spot. It's drkimbi.com, and that's drkimbi.com.
Thank you so much for being here with us, Dr. Kimbi. Everybody, you can find her online, and we appreciate you so much for sharing your wisdom that you've learned a lot the hard way on burnout. We just very much appreciate it.
You're so welcome. Thank you for keeping the conversation going.
Thank you so much for listening. This has been Sophia Unfiltered, a podcast by Sophia Health. I'm your host, Lauren Deitch. If you're interested in connecting to wellness professionals that can offer one-on-one support, visit sophiahealth.com or connect with us, our community, and providers anytime on social. If this episode resonated with you at all, we'd love to hear about it in the comments section of your favorite podcast provider or with a 5-star rating. Let us know what your biggest takeaway was from the episode, or share it with someone you hope to inspire. Join us again next time for more real conversations, stories, and insights that help empower you with the knowledge and inspiration needed to transform the way we take care of ourselves.